CT scans, also known as CAT scans, give medical professionals detailed pictures of the inner workings of your body, but they can also expose you to high doses of radiation. More than 80 million of them are performed each year, but a recent report says 1/3 of those serve no purpose. Here's Jennifer Krause with today's Consumer Matters.
Use of CT scans has exploded since the technology was invented some 40 years ago, and many people have benefited from its unparalleled ability to detect cancer, injuries, and other ailments. But Consumer Reports says misuse of CT scans can lead to serious consequences.
It's estimated that CT scans may be responsible for at least 2% of future cancers in the United States, resulting in 15,000 deaths a year. So it's clearly critical to avoid unnecessary CT scans.
Just one CT scan can expose you to as much radiation as 200 chest x-rays. But according to a recent Consumer Reports survey, just 15% were warned by a doctor of the radiation risks of medical imaging.
Another factor in the overuse of CT scans are doctors who own their own CT equipment. They have a tendency to order more CT scans than doctors who don't.
Consumer Reports says patients should always ask why a CT scan is necessary and if some other tests like an ultrasound or an MRI, which don't emit radiation, could be just as effective. If a CT scan is the right choice, keep in mind less radiation is needed if you are small and thin.
Once you do get a CT scan, be sure to get a copy of it so you don't undergo repeat unnecessary testing when you go to a new doctor or specialist.
Jennifer Krause, News Channel 5 HD.
Consumer Reports also says avoid those whole body scans that are often touted as a way to detect cancer early. They expose you to more radiation than regular CT scans and often lead to unnecessary follow-up tests. Look for a link to more information about radiation and medical tests on our website, newschannel5.com.